I have known of Dr. Itzhak Brook for many years through his work in anaerobic infections. I did not know until I heard him speak at the Society of University Otolaryngologists conference that he had cancer requiring a laryngectomy. He is an adjunct professor at Georgetown University. He is the past chairman of the Food and Drug Administration's Anti-Infective Drug Advisory Committee. He's the author of 6 medical textbooks, 108 book chapters, and has contributed to more than 700 scientific publications. A consummate educator and advocate, Dr. Brook has shared his experience in his book, My Voice, A Physician's Experience with Throat Cancer. And today, he shares with us a physician's perspective as a throat cancer patient. Will you please give a warm welcome to Dr. Itzhak Brook.
Good morning. It's a pleasure and an honor to be here this morning and address you on the topic of the patient view and experiences with throat cancer and laryngectomy. I'm here to tell you my own personal experiences, but in many ways, I'm here for many voiceless patients with throat cancer who are not able or cannot share with you their personal experience with cancer. As you can tell, I am speaking through a tracheoesophageal speech with a voice prosthesis. So, my voice is whispering, but this is now the way that I communicate, thanks to the wonderful invention that allows laryngectomy to speak. What I'm going to talk to you this morning is my own views of how I faced cancer and surgery, and what I learned from those views, how you can perhaps improve the care of your patient. I'll also share with you some of the challenges as a laryngectomy, and also about some of the challenges that I face and many others do with the medical and psychological and social issues throat cancer patients deal with. Throat cancer or head and neck cancer strikes the most basic needs of the human being: the ability to communicate, eat, and interact with others. And losing those is really a very devastating experience. Learning that I had been diagnosed with cancer was a shattering experience for me. I suddenly had to deal with my own mortality. I needed to deal with fear, anxiety, and uncertainty of the future. I had to trust myself in the hands of others to take care of me and give me even the basic needs. My relationship with others, with friends, family, workers, was really different and changed. And within a very short time, I had to make major decisions. What is the best treatment for me? And whether I should hide the fact that I have cancer, tell others or not. I also realized that there are several options available knew very little about the differences between different approaches. If you think that I had a hard time, imagine how a layperson has a difficulty making their best decision or knowing who is the best physician for them. What I can tell you is, ask yourself, are you the best person to offer the treatment and the surgery for your patient? Perhaps because of the rarity of throat cancer, there may be somebody else who may offer a better treatment than you. I know that as physicians, we like to help. We often feel omnipotent, but should you be the person or not, takes a little bit of humility and courage. Encourage the patient to get a second opinion and understand the great difficulty the patient faces learning that they had cancer, in making a solid, calculated decision. I can tell you that even though my physicians did an excellent job in explaining to me the choices, my state of mind was so anxious and illogical that I could not really be a very good decision maker about what is best for me. And my main interest at that time was to get the cancer out as soon as possible. I met physicians who were optimistic and some who were pessimistic. I prefer the truth, even if it's not so rosy. Of course, other people may not be able to handle the whole truth, and you should adjust it according to the patient abilities. Also remember, whatever you tell the patient, they may hear but not really listen or integrate. My doctors told me again and again what will happen, but when I woke up with tubes, IVs, catheters, and no voice, it was so different than everything they told me. That is the state of mind of a patient. Spend time with the patient. Tell them again and again. And also, there is no substitute for the power of a hug. My otolaryngologist hugged me each time he saw me, and his hug meant more to me than 1,000 words he said. And this is because I knew he really cared. I'm not asking that you always physically hug a patient, but an emotional hug is worse than anything else. What was very helpful to me is that I got to meet other laryngectomy prior to the surgery. I saw how they speak. I was aware of the choices I have. And it's also very important to allow the patient to talk as soon as possible, even with the help of an electrolarynx, because it facilitates the ability to communicate. really a big problem. I was never aware how common they are. It really made me watch again and again everybody around me, because they were made all the time by well-intentioned nurses and physicians, because we are all humans. Mistakes are done. But if there is an advocate, a family member, there are less of them. And encouraging the patient and the family to communicate and tell you about their condition and needs is very important. It's important to tell the patient what to expect in the future. It's important to implement standard techniques in the department so that mistakes are not happening. Having a log, a procedure that is everybody's Bible is a way to preventing mistakes. Surgeons are very busy people. They have a full schedule of surgery and clinics. You as a surgeon need to realize the patient needs you, not only as a surgeon, but as a person, as a physician who cares for them all the time. Spend more time, allow more time to communication and explain. Make sure the patient understands what is happening and understand how difficult it is for the patient to deal with everything. Having a team approach is very important. A physician, a surgeon, an internist, a nurse, social worker, and last and not least, a speech pathologist and a nutritionist as well, will guarantee that the patient will do better. The patient always worries, as I did, am I cured? For the first year, any symptoms, pain, swelling, I was almost panicking. Is it recurring? Well, there's no substitute to follow up. I had a recurrence that happened a year and a half after my initial tumor was irradiated and taken out. It was not discovered by PET or CT. It was discovered by an astute resident who did an endoscopy the way it should be done, with a valsalva that opened up the piriform sinus. And also, don't forget, the patient has medical, dental, and psychological issues that should not be ignored. And they do face a constant challenge of speaking, communicating. There are several ways of communicating, but being understood is really challenging to everybody. I do very badly in crowded places, restaurants. Many times people hang on me when I pick up the phone. There is discrimination. I feel it. There were several committees I don't sit on anymore, because initially, in the first year or two, I had great difficulty speaking. So I realized there is discrimination, especially for people who are younger and need to work a meaningful profession. One of the greatest help and the most wonderful profession that with them. I know many of you do, but many others don't. It's important to work hand in hand to improve the care of the patient, and most of all, remind the patient things will get better. Swelling will go down, and your speech will improve. One of the greatest challenges for all patients with cancer is the psychological challenge, depression especially, and this is because having so much difficulty to speak make us, and me too, more bottled in. You cannot express your feeling and emotion the way we did before. Our facial expression are really not always the same, and being speechless, in many cases, we can't share what's going on. Depression is a big enemy. There's other issues in the slide, but there is a way to overcome the depression, and everybody can find an honest way. My main motivation to fight my dark moments was to remind myself that I have to set an example for my children, that one doesn't give up in adversity and doesn't resign. Finding a purpose to life is very important. Returning to previous activities, working, seeking support from support group, psychological and even psychiatric. Many people give up on life. The rate of suicide in head and neck cancer is one of the highest among many types of cancer. Getting the patient on medication, antidepressant, is very, very useful as well. Well, life as a laryngectomy is not as bad. In many ways, it allowed me to experience life in a different way. There's some advantages. Well, I learned to economize in words, because I know I have a certain amount of words that I can deliver before my prosthesis and a base plate will start to separate. We also don't have to wear ties, which is great. I never liked it. And I don't snore anymore. And also, I don't get colds anymore. It's important to use the setback in life in a positive way. I asked myself when I got cancer, I never asked for it, but let me make something good out of it. So for me, it gave me a new direction to devote time to helping others by writing my own experience in the book, by talking to you and patients, and finding a way to find meaning. I know that many people with cancer have struggles not less than we do, the laryngectomy. But we wear our cancer on our throat. Everybody can see it. So in many ways, what I tell other patients, we are a sign and a symbol that lives goes on. Despite cancer, we can and should continue. I know that I'm a better physician than I used to be. I always cared for people, but now I know what they actually feel, and that makes
insights, and particularly your generosity in providing a copy of the book to all of the residency programs in the United States, and also to provide us with an ebook that's available to every one of you as an Academy member. Thank you very much.